I was speaking about Euro Melanoma campaign. It's a campaign that we organize since now more than 15 years. And this is, the idea is to provide information about skin cancer prevention and early diagnosis in all Europe. And I'm coordinating this campaign just to give the material to all the country to be able to organize locally a campaign. And every year we have a new campaign, and we try to have a common communication, but also strong communication, quite new, modern, just to give information about this skin cancer prevention. It's not always easy. The success is given certainly by the media reaction that we have after a campaign. And in fact, we see after that people are coming more frequently to be screened and more concerned about skin cancer. The northern countries are certainly the ones who are responding the best, also because we are more able to evaluate the impact also with a number of the melanoma that we diagnose. Because in fact we're working in more than 30 countries, and some of the countries it's difficult to get all the results to evaluate really. That we have a good, we got better results coming from the northern country. It's very difficult to influence the behavior. Certainly the acting on primary prevention is certainly the most difficult aspect of the prevention. But we act certainly on the fact that people are coming more frequently to be screened and check their mole, and they have the knowledge about skin cancer. And as you know, skin cancer can be seen, it's visible, it's easy to discern the risk factors, and for that reason it's easy to communicate with the public. And I think it's an ideal cancer to be on a campaign. They have the most experience because they have the highest incidence. You know, it's a lot of people who will get skin cancer in Australia, so they are very much concerned about that. And indeed, they get now results where they see a decrease in the number of melanoma since a few years. So this is a very important goal that they could reach with their campaign. Sunbed use is really a concern, because we go to the sun also during the holiday, and this is associated with relaxing and all the familial events. But sunbeds on itself provokes also skin cancer without any use of being exposed artificially. And it's a main concern, because in Europe we have a huge prevention of use of sunbeds, and we realize some of the country, and I'm from Belgium, nearly 40% of young female was less than 35 years are using sunbeds, and so it's a real concern. And we have some legislation, so it's banned under the age of 18. And we restrict to people who are not too fair skinned, but still it's really a concern. And it's more than Belgium. It's certainly the northern country, but also Hungary, and we see also, for example, Spain and Italy. So it's not only related to the northern latitude. So this is a concern, because we add to the sunshine exposure something which is absolutely not useful. We know that in fact when we are exposed to UV, it can induce the synthesis of endorphin in the same time. So in fact some people are really getting addicted to sunbeds. This is a small group of people, but still this is a main concern about prevention of skin cancer.